Welcome. NSG 515. Study Section 3. The Intensive Care Patient and Nursing. Introduction. You have discussed the intensive care unit in the last study section. However, in this study section, you'll be talking about the intensive care patients and the roles of nurses. You will start by identifying the types of patients that are found in the intensive care units. You will also be highlighting the roles of nurses in the ICU. Finally, you will examine the common problems of critical care patients. Learning outcomes. When you have studied this section, you should be able to describe the intensive care patients. Intensive care patients. As we have discussed in the last session, the intensive care unit is designed to meet the special needs of critically ill clients whose conditions can be reversed. A patient may be admitted in the ICU if he is physiologically unstable and requires sophisticated clinical judgments. Such patients could be at risk of serious complications which requires intensive nursing support that is related to the use of intravenous polypharmacy and advanced technology. Lewis et Kemper, Dexin, 2010. ICU has been shown to benefit patients who are severely ill and medically unstable, that is, they have potentially life-threatening disease or disorder. Although the criteria for admission to an ICU are somewhat controversial, there are 5 recommended priorities that intensivists should decide this question. These priorities include: 1. Critically ill patients in a medically unstable state who require an intensive level of care, monitoring and treatment. 2. Patients requiring intensive monitoring who also require emergency interventions. 3. Patients who are medically unstable or critically ill and who do not have much chance for recovery due to severity of their illness or traumatic injury. 4. Patients who are generally not eligible for ICU admission because they are not expected to survive. 5. The 5th category patients require the approval of the ICU program before admission. Activities in ICU. Nurses generally have a huge role to play in the intensive care unit. In fact, the role of a nurse is a complement to that of a doctor. A doctor will not be able to perform his life-saving duty if the nurses are not on ground. Some of the roles of these nurses are discussed below. 1. Hemodynamic monitoring. Pressure, flow, and oxygenation within the cardiovascular system. Circulating assist device monitoring, used to decrease cardiac work and improve organ perfusion in patients with heart failure. Artificial airways monitoring, mechanical assistance to help maintain patients' airway. Monitoring oxygenation and ventilation, maintain tube patency. Monitoring of mechanical ventilation, mechanical ventilation. The article below emphasizes more on these roles of nurse at the intensive care units. Critical care nursing are those specialties dealing with human responses to life-threatening problems. So they can require in-depth knowledge of anatomy, physiology, pathophysiology, pharmacology, and advanced assessment skills. Critical care patients is generally admitted to the ICU for one of the 3 reasons. Patients may be physiologically unstable, requiring advanced and sophisticated clinical judgment by the nurse or physician. The patient may be at risk for serious complications and require frequent and often invasive assessments. The patient may require intensive and complicated nursing support related to the use of intravenous polypharmacy, sedation, drugs requiring titration, neuromuscular blockage. Common problems of critical care patients. Patients admitted to the ICU are at risk of numerous complications and special problems. The use of multiple invasive devices predisposes them to hospital-acquired infections, sepsis, and multiple organ dysfunction. So, adequate nourishment for the critically ill patient is very important. Some other problems of ICU patients include nutrition, anxiety, pain, impaired communication, sensory perception, and sleep disorders. Study section summary. In this study section, you learned that intensive care involves dealing with human responses to life-threatening problems. The patient in ICU is physiologically unstable, requires advanced judgment, is at risk of serious complications, and requires complicated nursing support. The patient in ICU has problems with nutrition, anxiety, pain, communication, perception, and sleep. Nursing activities in the ICU should be directed towards solving these problems as well as to provide support to the families of the critically ill. End of study section 3. Thank you.